Hey, hi. My name is Madeline Mead, and my video is on two scenarios that they are involved that involve consultant and consultee a video response. Um, for the first scenario, uh, it gives me um, a brief synopsis of what the problem was, or the consulting, the response from the consultant for the consultee. The first one says, "This job is so stressful. I never imagined that managing a staff of seven could be so draining. Everyone uh, is wants has different agendas. No one seems to realize that I can't please everyone all the time." Now, the first consultant responds, "It sounds like you feel a lot of pressure to keep everyone happy, and no one seems to realize how hard it is." Consultant two responds, just for talking to you for 10 minutes, I can see that you're not assertive enough, and employees, your employees have lost respect for you. I think one goal of our work together could be to help you become more assertive." Now, in uh, what I said was, I think that consultant two answer is more effective because they get right to the point of what the problem may be, and then gives a way to solve the issue. Just knowing what the consultee is saying is not enough. The consultee does seem to have a problem with being assertive, and becoming more assertive with the seven employees may help to make sure that they know and understand that the consultee is only one person and can only do so much. The consultee will be able to set the stage for what the job entails and make sure that the job is being done regardless of who may not be happy with it. Um, if I was a consultant, I would answer with both responses. The consultant needs to know that they are being heard and understood. And once that part is taken care of, and then I would proceed to let the consultant know what I think is wrong and in what way I believe is best in resolving that issue. Consultant two, I believe, is more effective in getting that point across and giving the consultee a way to resolve the problem. Now, in scenario two, we have the uh, consultee saying that, "I'm really worried about Madison." She's talking about a student in the classroom. She went to the counselor and said that she's worried about this student. She says that she seems to cry too easily. I'm wondering if something is going on at home. Consultant one says, "Tell me a little bit more about what you're seeing." And consultant two says, "What time is the next faculty meeting?" Now, with these responses, I definitely went with consultant one because they have the response that I would pick for this scenario. The consultant needs more information of what is going on with the child before making a conclusion on how to move forward. Simply because a child cries a lot does not necessarily mean something is going on wrong at home. The consultant should be asking some questions about the child's overall behavior, such as, does the child cry out in act out in class besides crying? Are there any other signs that the child may be having trouble at home? And what has been some reasons that the child is crying in class? Would have responded with a question similar to the one above, where the consultee is asked what is making the child cry in class. This is because there may be a problem that the child is having with the classroom environment or with a particular child in the classroom. I would definitely need more information as to why the child is crying in class. And maybe we could figure out if the child has issues with the classroom, or if the problem may be stemming from something at home. Um, One thing that I did see overall with the consultee responses is that um, there initially the second consultant was not even uh, dealing with what the consultee was saying. They went on to ask a question that was definitely not one that dealt with the issue about the next faculty meeting. Well, the next faculty meeting, I think, has little to do with why this child is crying in class. There needs to be more information. The teacher should come back to the counselor when they with information about why the child is crying in class, uh, what seems to be uh, what seems to be causing these outbursts, and if the child is uh, does the child have any I don't know scars or bruises or anything like that that would make the teacher think that they have a problem with at home. Um, is the child crying at a certain time of day? Could it be that the child is just homesick and not really into the school environment? There could be a number of issues that why the child is crying in class. Um, I would want to have more information definitely about this. I would go back to the classroom if I was a teacher, and I would observe the child over a number of days, and I would see what was causing this. I would ask the child questions about why she's crying, um, how she feels. Is someone in the classroom bothering her? Um, I would probably not go to asking her what's going on at home, or if there's something going on at home. I would just simply ask her what the problem was with her and why she was crying in class. If the child then wanted to initiate a conversation about home, I would definitely allow her to do that. And if it came out that there was a problem at home, then I would take that to the counselor and allow the counselor to speak with the child, and then come up with some form of some form of resolving the problem with the child, maybe bringing the parents in, or talking with the child more and seeing if the problem is basically her, or if someone else is causing the problems at home. Once again, my name is Madeline Mead, and this is my video response to Module 4 assignment. I want to thank you and have a good day. Goodbye.